Welcome back to All Things Money. I'm David Blain, and during today's show, we're discussing a little bit about health insurance. During the first segment, we talked about health reimbursement arrangements, HRAs, or Section 105 plans. If you happen to miss this segment, feel free, in a week or so, we'll have it posted on the website, www.dlblain.com. That's DLBLAIN.com. And there you'll find not only archived copies of this show, but previous shows. There's also some articles that we've written and some information on myself and my firm. If you have any questions or comments on today's show or something you'd like to see in a future show, our phone number is 252-633-0107. And our email is allthingsmoney@dlblain.com. That's allthingsmoney@dlblain.com. As I mentioned in the first segment, we were discussing what's called a HRA, Health Reimbursement Arrangement, or Section 105 plan. Is a great tool for self-employed small business owners to use in their business. It's what we use at my company. And essentially it reimburses employees for qualified medical expenses on a tax-free basis. During this segment, I want to move into health savings accounts. Health savings accounts are another great alternative out there. And the basics of a health savings account is for someone that is not qualified under another health plan, so a self-employed person, or if you work at a company that doesn't offer any type of insurance, you may be eligible for an HSA, a health savings account. A health savings account allows you to contribute money, tax-deductible money, to an account and use that money in the future on a tax-free basis for medical costs. So let's back up a little bit. In the tax code, if you have medical costs, they are deducted on Schedule A as an itemized deduction. And not only are they under the itemized deduction section, but they have to exceed 7.5% of your adjusted gross income. So for example, if your adjusted gross income is $100,000 a year, your medical bills must exceed $7,500 before any of it is deductible. So only the portion above $7,500 is deductible. So don't worry about the math too much on that. It's just the point is that if you're paying for medical care out of your pocket, you're losing some of the deductibility of that just the way the tax code works. So what the HSA does is it says, well, let's allow people to make a tax-free contribution or a tax-deductible contribution to an account. And so let's say you make $100,000 a year and you're married. In 2010, if you're under age 55, you can contribute $6,150 to an HSA. So that immediately comes off the top and reduces your adjusted gross income by that amount. By the way, in case you were wondering, if you're single, the limit is $3,050, and people 55 and older get another $1,000 tacked on top of that. These HSAs are paired with what's called a high deductible plan, meaning that for family coverage, the minimum deductible must be at least $2,400. For single, it must be $1,200. They also have maximum annual deductible and out-of-pocket limits. So for a family, it's $11,900, and for one person, it's $5,950. So you have the health savings account, and then you have the high deductible health plan, and these two things are paired together. One thing that you pay out of your pocket for the health premiums. By the way, if you're self-employed, those premiums are tax deductible as a self-employed health insurance deduction. So you pay out of their pocket for a premium. It's a high deductible plan, and so you are responsible for the first several $1,000s of health care. I happen to have an HSA, and you can get Deductibles, as I mentioned, the minimum deductible for a family would be $2,400, and they generally go up to around $10,000. The beauty of the HSA is you know ahead of time exactly what your maximum costs would be. So let's say you contribute your $6,000 to the HSA, you take your tax deduction, and then later in the year, your child gets sick or they fall down and break their arm and you go to the hospital and you get a bill for $2,000. Well, you have a high deductible. Let's say your deductible is $5,000. So now a lot of these HSAs have debit cards. So while you're at the hospital or emergency room, you could actually give them your HSA debit card and pay for that care, and it's subtracted from your health savings account. That's tax-free. The money you spend from the health savings account is tax-free. The beauty, one of the other aspects of this is if you accumulate money in your HSA, you can actually invest it. So it becomes sort of like an IRA where if you're contributing money and you're not spending it, you can take that money and you can invest it in stocks or bonds or something that pays you income. And this money grows tax-free. So if you're 40, you could put away a lot of money, and then when you're 65, maybe then you start to have more medical bills. You can pull that money out tax-free. So not only did you get a tax deduction when you put it in, but it's tax-free when you take it out. These plans can also be set up by employers who make the tax-deductible contribution for employees. Well, that brings us to our next break. When we come back, we'll finish up on some health insurance plans, and we'll take a few of our viewers' questions. For All Things Money, I'm David Blain.